Regardless of the type of asthma that you have, everyone who has asthma really should have an action plan. The action plan is a step-by-step description of what medicines to use at what stage. Whether or not that your symptoms are an increase in cough, chest tightness, shortness of breath, or increased work of breathing, you're not going to be able to tell exactly where the asthma is just from looking or listening. And so first thing we start off with the action plan is the fast-acting treatment, which will kind of give us an idea of where we are in the course. Albuterol starts to work in about 10 seconds. The peak effect is about 15 minutes and it lasts for 3 to 4 hours. It is very good at trying to relax any of the muscles that are in spasm right now. It is not very good at protecting those muscles from going into spasm even an hour from now. So I never use albuterol really on a schedule. You use it when you are seeing the symptoms that are bothersome, and then you watch to see how well it responds. Whatever gets better, you know that's the muscle spasm part. The other part, as we talked about earlier, is the swelling and mucus on the inside of those tubes. Albuterol doesn't do anything for that. The only thing that we know that will take that down once it's there is one of the anti-inflammatory steroids. Those medicines usually take 12 to 24 hours to start working, so they don't work fast. But they will shrink the swelling and mucus that's down there. They'll stop new mucus and swelling from coming, and it decreases the twitchiness to break the whole cycle. The steroid is the definitive treatment for an asthma flare, whereas albuterol, all we're hoping to do is get short-term symptom relief, and it will only work if it's muscle spasm. When we start the prednisone, the goal is to get the air tubes completely clear. We don't want to leave even a little inflammation on the inside of those air tubes, or we risk either having that drag on for a long period of time, or even possibly cycling back into a new flare even without a new trigger. On the other hand, once we've gotten clear, there's no reason to keep taking it. It's not like an antibiotic where you have to finish the course. And so when you start coughing, seeing coughing to the point where it's bothersome, or any increased work of breathing, then you reach for your action plan. Your action plan is going to start with albuterol. If the albuterol clears things for 3 to 4 hours, that's all you need to do. You just repeat the albuterol when needed. The first time it doesn't clear you for 3 to 4 hours, now you know that we're starting to have the swelling and mucus on the inside of those air tubes, and it's time for the steroid. When we start the steroid, we go twice a day until completely clear. Zero cough, wheeze, or chest rattle for 24 hours, and then stop. The limitations is that I don't want you going more than 10 days without talking to us. Ask you to call me the next business day whenever you start the prednisone or the steroids. It's not asking permission. I'm giving you permission now. The reason for the phone call is so I can monitor how often it's happening and how close together to make sure that we don't run into any trouble with it. If you've gone 10 days and you're still not clear, and sometimes some of the viruses, some of the triggers last more than 10 days, so you might not get clear by the end. And in those instances, at 10 days, we need to start talking about where we're going to go from there to keep moving forward as safely as possible. And we'll talk about that on the phone. We have been doing prednisone or those kind of steroids for asthma for 75 years. We know of no long-term side effects to using the short courses the way that we do in asthma. There are a handful of short-term problems that you can see with them. but those should all fade away within a few days of stopping the medicine. Um, One is you can get puffy. Two is it can really turn your cheeks bright red. Three, it can triple your appetite. It doesn't increase how much you need to eat, it just chemically makes you hungry. So you want to be careful about what you eat while you're on the prednisone, because if you eat 3 times normal calorie amounts, you're going to put on real weight that won't come off just because you stop the medicine. Fourth thing is it can make you moody. Anything from being wired to whiny to mean. Most people don't have more than a little bit of those kind of problems, but certainly 5 or 10% have some real significant behavioral changes when you're on them. And if you do, make sure you let us know. There's some tricks we can do to try to cut that down. One of them is using a medicine called Medrol, or methylprednisolone. That is basically a cousin of prednisone, and we have very good success getting rid of a lot of the behavioral problems from the prednisone by going to Medrol. It's just a little more expensive, so we don't start with it first. The other problem with it is that it only comes in a pill form, and so if you have little children or children that can't swallow pills well, you'll have to dissolve it or crush it up and put it into a bite of something. Like all steroid tablets have a very bitter aftertaste, so you want to give something potently sweet afterwards to get rid of that aftertaste. I found nothing that works perfect for everyone, but root beer is probably the best thing that I've had that chases it for most people. If you read the media or watch TV, you'll hear them talking about the evils of steroids and how steroids kill and things along those lines. Those are simplifications, I would say. What they forget to tell you is that every hormone in your body is a steroid, and we don't survive one day without our steroids. Most of what they're talking about are anabolic steroids, which are mimics of testosterone that athletes take to try to bulk up or things along those lines. The steroids that we use are mimics of cortisone, and really don't have any of those same kind of properties. Like all hormones, you need to be careful about the way that you use them, but as long as we use them the way that we should for asthma, we shouldn't run into any of those problems.